Professor of Forensic Medicine. Now let me speak on 20 RDX questions along with proper explanation. Okay, I think all of you have done very well in your exam. Now coming to the first question. A doctor injects penicillin without giving test dose, the patient dies. Post-mortem examination reveals that the death is due to myocardial infarction. Whether the doctor can be charged for civil negligence or criminal negligence or both or none. Now, you should know various BNS sections. There are 4 BNS sections: 125, 125A, 125B, and 106. 125 BNS deals with rash and negligent act endangering the life of the person. Endangering life. 125A, rash and negligent act causing hurt. 125B, rash and negligent act causing grievous hurt. And 106, causing death of the patient. And for a doctor, maximum up to 2 years of imprisonment. Okay. Now, in this question, civil negligence means whether in case of death, the nearest kith and kin, whether he will ask for damages in a court of law. Damages means compensation. In this case, there is negligence, definitely. He injected penicillin without giving test dose. He did not die of anaphylactic shock. If he dies of anaphylactic shock, there is direct causation. But here, he did not die of anaphylactic shock. He did not die because of the complication of penicillin. Even otherwise, he would have died by myocardial infarction. So his wife or any nearest kith and kin cannot ask for compensation. So we charge it for civil negligence means civil suit for compensation. No, that is due to negligence. What about criminal negligence? I told 125 BNS. Endangering the life. By his negligence, he would have endangered the life of the person. So he can be charged for criminal negligence as per section 125 of Bharatiya Nyaya Samhita. Okay, clear? Okay. Now coming to the second question. I hope all of you understood about the first question, the concept behind the first question. Different techniques of autopsy. Now, there are 4 techniques. As I show you in a single frame, Little's technique means en-masse dissection or en-block dissection. Gauss technique is block by block dissection. Workhorse, organ by organ, Rukitansky, in situ dissection. But here the problem is, teachers, as in some books, some authors also mentioned Gauss technique as en-block dissection. That is wrong. It is given perfectly only in a standard textbook, international textbook, Bernard Knight's forensic medicine or forensic pathology. En-masse means all together or in a group. En-block means same. En-block, en-masse, both meaning same. All together or all at the same time. What Bernard Knight has given in his book is organs are removed en-bloc by a modified Rokitansky procedure, more accurately described as Lectue's method. So Lectue's method is also known as en-masse or en-bloc, where entire organs right from, sometimes they say tongue to prostate, but I don't want to say tongue to prostate, tongue to rectum. Everything, oral, cervical, thoracic, abdominal, pelvic are removed as a single large organ block, mostly done in medical colleges to teach UG and PG students. Look here, right from tongue to rectum, everything in a single mass. Gauss technique means block by block. Normally they remove with 3 different blocks. That is oral, means cervical oral along with cervical and thoracic organs as 1 block, abdominal organs as 1 block, urinary system as 1 block. Workhorse means organ by organ. It is the most common method in India. And Rokitansky in situ dissection, it is done in case where the dead body, it is a known case of some infected disease like HIV, HPSAG, COVID, or whatever it is, or when you suspect infection in a dead body. So now you got the answer. The latives is en bloc. Gons is block by block. Workhorse is organ by organ. Progatansky is in situ dissection. Okay. Number 3. 53 male patient brought to the hospital with issue of starburst, burn involving face and head, changing of a neck, both arm, front of chest, bilateral. Now, you know very well, estimation of body surface area. Of course, the best is Lund and Broder chart. It is very complicated. Normally, what we adopt is Wallace rule or rule of 9. You know, head and neck is 9, front of the chest 9, back of the chest 9, front of the abdomen 9, back of the abdomen 9, each upper limb 9 and 9, each lower limb 18, 18, front 9, back 9, like that. But here, you should know the subdivision. Now, in the head, I said 9, but here, head plus neck, 7 plus 2. Upper limb, arm, forearm, and hand, 4 plus 3 plus 2. Lower limb, thigh plus leg plus 10 plus 5 plus 3. Okay. Now, look here. Face and head, 7. Head. Both arms, only the arms, 4 plus 4. Front of chest, bilaterally, 9. Totally, 26. That is regarding the third question. Okay. What is the maximum age of the person by the analysis of carpal bones in this X-ray? Now, there are 8 carpal bones. The first carpal bone to appear is the capitate, the biggest bone, biggest carpal bone. Then it goes anti-clockwise. Hamate, 3 months. Tracheotomy, 3 years. Lunate, 4 years. Scaphoid, trapezium, 4 to 5 years. This is following as per Dr. Anil Agarwal's strict book. Finally, Pisciform, 9 to 12 years. Remember, first is capitate. The earliest alphabet in English is C out of these 8. So capitate, 2 months. Tracheotomy, 3. Lunate, look like L, 4. 4 years. Okay. Now, 1 year child will have 2 carpal bones. 2 years also have 2 carpal bones. 3 years, 3 carpal bones. 4 years, 4 carpal bones. 5 years plus 3, that is 7 carpal bones. 12 years, all 8 carpal bones. Okay. Now, many times students get confused whether Pisciform is appeared or not. You see here, you can see a line of demarcation because between the overlapping, you can see the line of demarcation because of the double density. Look here, you can see the double density. Once 2 bones are overlapping, you can see the double density on radiological examination. Which of the carpal bone is first to ossify? First ask in Ames, November 17, capitate. What is the predicted bone age from the wrist radiograph given below? Here you see all carpal bones appeared, but not the Pisciform. Pisciform appears at 9 to 12, so age is less than 12 years, so answer is less than 15 years. Determine the age of the individual. 4 carpal bones. Lunate appeared 4 years. Now, 3 carpal bones. Tracheotomy is the third carpal bone to appear, so 3 years. Determine the maximum age of the individual. 2 carpal bones. 2 months, 3 months. Next is trichotrom, 3 years. So age is less than 3 years. So answer is 2 years. At the same time, here, absolutely now, no carpal bones at all. That means less than 3 months. So which answer A? Less than 1 year. Okay. Now coming back to the question, the maximum age by person also carpal bones in X-ray is all carpal bones appear except Pisciform. Perjury appears at 9 to 12 years, so age is less than 12 years. So maximum age cannot be 13, so answer is 10 years. Okay. What is incision preferred during autopsy in case of asphyxia death due to neck compression? Here again, many teachers are teaching wrongly, but I give you a proper reference by one standard Indian textbook and one Bernard Knight. Okay. Look here, most common incision is I-shaped. Symphysis mentile to symphysis pubis, avoiding the umbilicus. It is most common and routine incision. Number 2, Y-shaped incision starts from both mastoid down to the sternum notch, down to the pubic symphysis, avoiding the umbilicus. It is normally done in neck injuries as well as asphyxia death by compression over the neck, like ligature strangulation, manual strangulation, cutthroat injury. Okay. Look here, it is a Y-shaped incision. Then they reflect the skin You can expose the entire neck, then open the chest and abdomen. Modified Y shape normally done in females for cosmetic purposes. Here, as you see, incision start from both acromion, away the breast, below the breast, to reach the exhibit sternum, down to pigment symphysis, avoiding the umbilicus. It is for cosmetic purposes because in case of males, you can close the first button. Incision will not be seen. But females, if they wear sari blouse or salwar kameez, then the incision will be seen. To avoid that, they can use that. Look here, modified Y-shaped incision. Second picture, you can elevate everything upwards along with the breast. Then once you suture, the incision will not be seen. Okay. Now the problem is, Naran Reddy especially has given what I said, Y shaped as modified Y and modified Y as Y, but that is wrong because the reference is from Christian, which one of the standard textbook in India, where he mentioned Y shaped means both master down to sternal notch, down to pubic symphysis. And in the second method, anterior axillary fold, curving under the breast, nipples, meet, zipesternum, modified Y in case of females, and Y-shaped incision is done in case of strangulation, hanging, any condition where the larynx might be damaged, but not night. Understood? Remember, I am not teaching you wrongly. Okay, I'm not teaching you wrongly. Remember that. Now, X-shaped incision done in case of suspected torture. Suspected torture, where we are reflecting the skin of the entire body. Look here, a condition called gotna, where the bamboo stick will be rolled over the body. On apparent examination, there will be nothing. But once you cut open, you can see multiple bleedings or contusions. To rule out that, we go for X-shaped incision. So aspect that due to neck compression is Y-shaped incision. Y-shaped incision. Okay. I hope all of you have mentioned the answer as B. Now, identify the range of gunshot injury by the image given below. Look here. When you fire a firearm, what are the products of firing? Ah, flame. Flame is the fire. Along with that, there will be soot and smoke. Entire amount of the gunpowder may not burn completely. Some amount may be partially burnt and some amount may not be burnt. So I call it as powder particles. So what you see here, flame and hot air, smoke and soot, powder particles and wind. Now, what are the effects of these products of firing? Flame and hot air causes burning of the skin and burning of the hair. Burning of the hair is known as singing. Soot and smoke causes smudging or blackening. Powder particles penetrate into the epidermis, get penetrated into the epidermis and embedded in the dermis, give rise to a condition called tattooing or peppering or powder stippling. And bullet causes a wound of entry. Along with that, there is the grease collar and abrasion collar. Grease collar is also known as, one minute. Okay, the grease collar is residue from the barrel. When the bullet comes, it will come out along, it comes on the surface of the bullet and it gets wiped at the wound of entry. So it is also known as bullet wipe. The firearm injury, tattooing noted around the wound of entry. The cause of the tattooing is unburned gunpowder particles. Very easy question. Knowledge in case of gunshot injury, blackening was noted around the wound of entry. Blackening is due to smoke and soot. Now, coming to the distance shot. Distance shot means the victim is away from the reach of the projectile. Okay. Now, what do you mean by contact shot? Contact shot means the muzzle is touching the skin. Okay. Close range means the target is beyond the reach of the muzzle. The muzzle is not touching the skin, but within the reach of the flame. Near range or near shot means the target is beyond the reach of the flame, but within the reach of the smoke and soot. Intermediate range means the target is beyond the reach of the smoke or soot, but within the reach of powder particles. And distant range means the victim is away from the reach of all other products of firing except the projectile. Now, I tell you so that later it will be easy for you If the target is here, what you see is only the wound of entry. Only the wound of entry surrounded by grease and abrasion collar. If the victim is here, intermediate shot, along with the wound of entry, there will be tattooing. If the victim is at the near shot or near range, there will be wound of entry, tattooing plus blackening. Okay. Meantime, if the target is in the close range, there will be wound of entry. Of course, whenever I say wound of entry, along with that, there is grease collar and abrasion collar. In addition to that, there will be tattooing. In addition to that, there will be blackening. In addition to that, there will be burning of the skin and burning of the hair. Contact shot I explained under three different headings. Now, coming to the distant range, I told only the wound of entry along with grease collar and abrasion collar. So very easy to identify. If at all this image is given to identify, you just look whether wound is surrounded by any other thing like blackening or tattooing. Nothing is there. It is distant shot. Only abrasion collar around the wound of entry caused by a rifle firearm is seen in distant shot. See, so many questions asked in innocent examination. Intermediate, I already told, there will be wound of entry surrounded by tattooing. Surrounded by tattooing. Look here. Very easy. Okay. See the difference between distant shot and intermediate shot. There is no tattooing in distant shot. Tattooing is there in intermediate shot. A dead body with gunshot wound is brought on examination. There was a wound of entry with abrasion called inverted margin surrounded by tattooing without burning and blackening. Only tattooing is seen in case of intermediate shot. The following is victim of firearm injury. What is the suspected distance of the shot? Again, asking Ames, May 16. You can see the wound of entry just above the eyebrow surrounded by tattooing. So it is intermediate range. Identify the range. Again, almost same picture. It is the wound of entry surrounded by tattooing. So answer is intermediate range. Now, near shot. Near shot. A wound of entry with tattooing plus blackening. Plus blackening. Look here. I hope all of you got proper concept. Now you see the difference between distant shot, intermediate shot, and near shot. See, intermediate, no blackening. Near shot, there is blackening. Identify the range of gunshot injury by the image given below. Ask in NEET PG 2024. We can see the wound of entry surrounded by tattooing and blackening. It is a case of near shot. Okay. Number 4, close range or close shot. Now you have become master. You know very well. There will be wound of entry plus tattooing plus blackening. In addition to that, there will be singeing of the hair and burning of the skin. Look here. You can see the burnt skin. You can see. Or look here. The enlarged picture you can see. You can see the burning. That is close shot. Now you see the difference between these four, the distant range, intermediate range, near range, and close range. Okay. Contact shot. There are 3 different types of contact shot. Number 1, firm contact. Firm contact. Where there is indentation of the skin. Look here, not only touching, tightly touching. Indent. It is also known as tight contact or firm contact. Entire products of firing will enter into the wound track. Absolutely, there is no gap. What you see is only the muzzle impression. That's all. Only the muzzle impression. There is no leakage of any other products of firing. Only the bullet will enter. And you can see the muzzle impression. Number 2, loose contact shot. Loose contact shot. Here, there is no indentation. The muzzle is touching the skin, but at the time of penetration of the bullet into the skin, there is invagination of the skin. Then there will be a gap. Through the gap, hot air, the flame, as well as the smoke and soot may escape and collect around the wound of entry. That black deposition is known as corona. Corona. So look here. The findings are abrasion collar plus grease collar, blackening in the form of corona, burning and singing, and muzzle impression is unlikely because there is no firm contact. No firm contact. Okay. I hope all of you are understanding properly. Now, coming to the angled contact. Here, the gun is kept at an angle. Look here. Then there's a lot of gap. Through the gap, everything will escape except the projectile, means the bullet. Everything will escape. And the powder particle, the soot smoke, that get deposited in a ovoid shape. Ovoid shape. So what findings you see? Blackening, tattooing, burning, singeing, and partial muscle impression. So the where it is touched firmly, then there may be an impression. That is regarding angled contact shot. Okay. Now, contact shot on bony areas like head and sternum. You can see there is loose irregular tissue. Even on the sternum, you can get the looseness. So now, when the person fires, maximum amount of the gases will pass through the wound tract, but some amount get leaked and form a temporary bulge. As soon as the gun is dropped, whatever the gases collected in the temporary bulge try to come out with the same wound of entry forcibly, which causes splitting of the skin and give rise to large, irregular, cruciate shaped wound. Large, irregular, cruciate shaped wound. Okay. This is the only exception where wound of entry will not be circular or oval. Splitting of the skin takes place. Now, I show you in a single frame what are the various ranges. So, identify the range of gunshot injury by the image given below. Here, you can see the blackening, tattooing with wound of entry. It is a near shot. Number 7. A final year medical student had attended shortage as required by the university norm. The principal asked for the sexual favor in return to allow her to appear for examination. The student agrees for his terms as sexual intercourse with them and later lodges a police complaint. Under which section the principal is punishable. Now, 63 of Bharatiya Nyaya Samhita defines what is rape. 64 gives punishment for rape. Under 64 bracket 1, punishment for rape is minimum 10 years, which may extend to life imprisonment. 64.2 includes custodial rape. What do you mean by custodial rape? Rape by a person who is in a position of authority in his custody. Say, for example, a woman goes to a police station to lodge a complaint, there the police rapes her. Or a school principal rapes a student in his room. Not only principal, even head of the department, or even a jail superintendent, any responsible post position. If he rapes a woman inside the custody, it is custodial rape. Minimum 10 years, which may extend to life imprisonment. Life imprisonment, the sense, he should be there in the jail till his death. The imprisonment will not be commuted. He should be there in the jail till his death. Section 68. Section 68. Sexual intercourse by a person. It is not rape. It does not start with a rape. Sexual intercourse by a person who is in a position of authority, taking advantage of his official position to seduce or induce a woman for sexual intercourse, not amounting to rape. That means it is not custodial rape. It is sexual intercourse where the woman gives consent, but consent is given because of some kind, where he takes advantage of his official position to induce or seduce a woman. Minimum imprisonment is 5 years, which may extend to 10 years. Now we know the difference between 64.2 and 68. So here, woman has been assaulted by her husband, comes to the police station to lodge a complaint. There, only police personnel, and he rapes a woman. It is a typical case of custodial rape. So punishable under section 64.2 of Bharatiya Nyaya Samhita. Whereas in this question, I don't want to repeat the same. Here, punishable under 68 of Bharatiya Nyaya Samhita, whereas 69 BNS is not important for you. Your personal life, it may be important, but for forensic medicine exam, INI CET examination, it is not much important. Sexual intercourse by employing deceitful means false marriage. Or a person says, I'll give you a promotion if you have sexual intercourse with me, and it does not give promotion. All such by deceitful means comes under 69. What about cyanide poisoning? Sure, definitely all of you know the answer. Now, if I talk about the cyanide, double compounds are non-poisonous. For example, potassium cyanide is a deadly poisonous. Ferrous cyanide is a deadly poisonous, but potassium ferrocyanide is not a poison. Meantime, it emits bitter almond smell. But remember, 20 to 40% of the human population cannot perceive the smell, which is inherited as sex-linked recessive trait. That means it is not a constant, consistent finding. Number three, when you take a cyanide salt, it enters into the stomach, combines with hydrochloric acid and form hydrocyanic acid. If at all a person is suffering from achlorhydria, potassium cyanide will not get converted into hydrocyanic acid, then it may not become toxic. So they have very good prognosis. And drug of choice, according to FDA, is hydroxycobalamin. Hydroxycobalamin is the drug of choice. And remember here, there is three-step Lilly cyanide kit, which contain amyl nitrite by inhalation, sodium nitrite by IV, sodium thiosulfate by IV. That is known as three-step Lilly cyanide antidote kit or three-step Lilly cyanide antidote kit. Okay. In case of cyanide poisoning, say in case of strychnine poisoning, rigor mortis starts early and passes off quickly. But here, it starts early but passes off late. It starts early but passes off late. So now, smell of beta almond is consistent finding. No, 20 to 40% cannot. Achloride have poor. No, they have better prognosis. Hydroscopolamine is a drug of choice. Yes. Rigor mortis start early, passes off late. Yes, correct. So answer is B. 1 and 2 are wrong, 3 and 4 are wrong. Identify the type of the injury. Now let me explain about three important injury. Lacerated incisors, a chop wound. Laceration wounds are always caused by heavy blunt object. If not heavy, at least blunt object. Incisor wounds are caused by sharp cutting light weapon like a blade. Chop wounds are always caused by sharp cutting or sharp splitting heavy weapon like an axe. If you take a stone and hit on a person, the skin stretches. Once it crosses the threshold of stretching, it tears. So margins are irregular. The invaginated skin comes in contact with the side of the stone. So edges may be contours or abraded or bruised. Of course, contours or bruised are not same. And neurovascular bundles which are made up of elastic fibers will not get transected. Just like if I take iron rod and hit on a rubber band will not get cut. It gets stretched. So here, because of the stretching, neuromuscular bundles may be intact. Whenever you see a wound where neuromuscular bundles are intact, you should consider this as a lacerated wound. Whereas incisor wound and chop wound, neurovascular bundles will be not intact. And you can see the diagrammatic representation, identify the injury. As soon as you see the neurovascular bundle, immediately can say that it is a lacerated wound. If you take a knife and cut, margins are regular. Margins are regular. Meantime, there is no invagination. Edges are not contused or abraded. Edges are not contused or abraded. At the same time, neurovascular bundles are not intact. Neurovascular bundles are not intact. Okay, understood? Chop wound. Look here, this is a diagrammatic representation where you can see each and everything is cut neatly. Okay. Now, if I take an axe and hit a person, axe is sharp cutting heavy weapon. The margins will be regular because of the sharp blade. This. Once the invagination takes place, the side of the wound comes in contact with the edges of the wound comes in contact with the side of the weapon. So edges are contused or abraded, and neurovascular bundles are not intact, not intact. Okay. Now, again I say lacerated wound, margins are irregular, edges are contused or abraded, neurovascular bundles are not intact. And in case of incised wound, the margins are regular and the edges are not contused, not contused. Meantime, neurovascular bundles are not intact. In chop wood, margins are regular, edges are contused. Now, look here. You can see the neurovascular bundles. Answer is laceration. Ask in AIMS examination. What type of injury you can ask in AIMS May 16? You can see the margins. Margins are regular. Edges are abraded or contused. So it is a chop wood. Chop wood. Identify the injury. Now, I've already got the answer because you can see the neat margins, regular margins, contours or abraded edges. No neurovascular bundles. The answer is top. Let the following be in a section. Here, section 229 is very, very important. See, once you go to a court of law to give evidence, if you believe in the God, you have to take oath. If you don't believe in the God, you have to go for solemn affirmation. In the name of the God, I swear that I will tell the truth, the whole truth, and nothing but the truth. That is oath. Or I solemnly affirm that I will tell the truth, the whole truth, and nothing but the truth. That is known as solemn affirmation. Okay. Section 227 defines perjury. That means giving false evidence under oath or solemn affirmation. 227 defines what is giving false evidence, means what is perjury. 225 defines what do you mean by fabrication of false evidence? Fabricating false evidence definition. 229, what is the punishment for giving false evidence as well as fabricating false evidence? That means punishment for 227 and 228 BNS. Maximum up to 7 years of imprisonment. Up to 7 years of imprisonment. And section 234, issue or signing false certificate. Punishment is same as for giving false evidence. That means up to 7 years of imprisonment can be given. 27, 28, 29, 34 others. Okay. Very important. 229. So 227, giving false evidence. 228, fabricating false evidence. Both are definition. 229, punishment. And 234, issuing or signing false certificate. Answer is A. 11. A 22-year pregnant woman comes to for MTP on the ground of contraceptive failure. In such scenario, opinion of one doctor is sufficient, or a medical superintendent, the medical boards, MTP cannot be conducted. Anyway, because MTP is very, very important, I would like to discuss each and everything. Let me speak on salient features of MTP Act 1971, MTP Act Amendment Act 2021, MTP Amendment Rules 2021, Supreme Court ruling. Look here. Who can perform? Minimum 6 months of experience in OBG as our job, or even 1 year experience in OBG, or if a person has done DGO or MS or MD in OBG, or any RMP. RMP means registered medical practitioner who assisted in the performance of 25 MTPs, out of which 5 he should have done of his own independently. There is one exception. Up to 9 weeks of gestational period, 3 months of experience in OBG is sufficient. To 20 weeks, opinion of one RMP sufficient. 20 to 24 weeks, 2 RMPs has to appoint. What are the different grounds for MTP? See, one of the grounds for termination of pregnancy is failure of contraception in a woman or her partner. In other words, if a pregnant woman comes with the issue of failure of contraception, MTP cannot be conducted after 20 weeks. After 20 weeks, only for failure of contraception. Maybe in a woman, maybe in her partner. Now here, Termination can be done, contraceptive failure in. Previously, before this 2021 Act, it was a ground only in case of failure of contraception only in a married woman, but now in anyone. Up to 24 weeks in case of rape, even husband has forcible sexual intercourse with the wife, and if she become pregnant, she can also terminate her pregnancy up to 24 weeks. Number two, pregnancy due to incestual relationship. Number three, case of minors less than 18 years of age. Number four, in case of change in marital status, maybe by divorce or maybe due to the death of the husband if she become widow. And number five, in case of physical disability. Number six, in case of mentally ill or mentally retarded woman. Number seven, in case of fetal malformation. Number eight, in case of famine, drought, or war, where government announced the particular area as humanitarian district because of the disaster. Up. MTP can be done even after 24 weeks, but in case of substantial fetal abnormality, it has to be diagnosed by a medical board which consists of a gynecologist, pediatrician, radiologist, and any other doctor nominated by the court. MTP can be done at any time, even up to full time, if the continuation of pregnancy endangers the life of the woman. Okay, to save the life of the woman, it can be done at any time. Consent of the woman is very, very important. Consent of the husband is not important, not required. And if the woman is mentally ill or minor, consent of the legal guardian should be taken. At the same time, you have to maintain the professional secrecy. Professional secrecy. You have to maintain an admission register which has to be maintained minimum for 5 years from the end of the calendar year. Minimum 5 years. Okay. And a monthly statement should be sent to the district health officer or director of health services. All these are regarding MTP. Now look at various questions. About MTP Act, in case of pregnant due to contraceptive failure, MTP is allowed till 20 weeks of gestational period. Presence of one of the following is not required to authorize termination of pregnancy in case of woman 27-week gestation period, substantial fetal abnormality. Very easy question. Lawyer. It should be another doctor. A 14-year-old woman with an alleged issue of sexual assault come to the obstetrician for termination of pregnancy with 22 weeks of gestation. So 22 weeks, two doctors has to opine. At the same time, the woman cannot give consent because her age is only 14. So MTP can be done up to 24 weeks because it is a case of sexual assault, rape. Two doctors required for 20 to 24 weeks. The following is punishable of a non-entry in MTP register and not sending monthly statement. Okay. 22 weeks pregnant comes to MTP on the ground of contraceptive failure. You cannot conduct MTP because it is only up to 20 weeks in case of contraceptive failure. A 20-year-old mentally challenged woman comes, the consent has to be taken from a legal guardian. Now we already got the answer. The ground of contraceptive failure, the MTP cannot be conducted. Okay, MTP cannot be conducted. Okay. A patient died from bronchopneumonia following an intracerebral hemorrhage caused by a cerebral metastasis from primary squamous cell carcinoma of main bronchus. Which of the following option is the most appropriate for line 1C or MCC, medical certification of cause of death? Now, many times students write wrong answer for this. Now, there is Roman 1. Under Roman 1, immediate cause and antecedent cause. Remember, immediate cause is always only one, that is A. Antecedent cause may be many. It may be only one, like B or B and C or C and D and B. Roman number 2, you can add any other conditions. If the person was suffering from any other condition not directly related to the cause of death, you can mention under other significant causes. In 1A, you should write exactly the cause of death. State the disease or injury complication, not any vague terms. Like, You can write died due to respiratory failure, cardiac respiratory failure, died due to diarrhea, died due to loose motion, died due to fever, died due to common cold. You should not write like this. It should be exact diagnosis. Okay. And meantime, antecedent cause. What condition given rise to immediate cause of death? You should write under 1B. What is given rise to 1B, you should write under 1C. What is given rise to 1C, you have to write under 1D, like that. Okay. Meantime, other significant condition, already I mentioned, contributing the death, but not related to the disease or condition causing to it. In other words, I show you 4 generations. Last who is born is the small baby. If you consider the small baby as 1A, her mother, the baby due to her mother, she is 1B. Her mother is due to her grandmother, she is 1C. Her grandmother is due to her great grandmother, she is 1D. In other words, what comes last should be the first. For example, the baby has come last, she should be the first in death certificate. A person died of septicemia due to peritonitis as a result of perforation of chronic duodenal ulcer. What comes last? Septicemia. He died due to septicemia. 1A. 1A is due to what? 1A is due to peritonitis. Peritonitis is due to what? It is due to perforation of chronic duodenum. And why it is perforated? Because he suffered from chronic duodenal ulcer. At the same time, if the person was also suffering from, say, hypertension, diabetes, he can mention under Roman 2. So now here you see, immediate cause septicemia in 4 days, acute peritonitis 7 days, perforation duodenum 7 days, chronic duodenal ulcer 4 years. He also suffered from diabetes mellitus since 5 years, hypertension since 10 years. 1A, myocardial infarction. 1B, it is due to coronary occlusion. It is due to atherosclerosis. Very easy. Myocardial infarction, coronary occlusion, atherosclerosis. He also had diabetes mellitus and hypertension. Now you become perfect in writing MCCD. 1A, lobar pneumonia as a result of measles. 1A, uremia, which is due to chronic bilateral renal failure, which is due to the hypertension, which is as a result of polycystic kidney disease. Okay. A person died due to tuberculosis. Many students write here 1A is respiratory failure. You are wrong. You should not write respiratory failure. 1A is lobar pneumonia. So now in this particular question, what comes last is bronchopneumonia, that is 1A. 1A is due to intracerebral hemorrhage. Intracerebral hemorrhage, person has become comatose, which has given rise to hypostatic pneumonia. That is 1B. And hemorrhage is due to rupture of the cerebral metastasis, 1C. And metastasis due to originally squamous cell carcinoma of left main bronchus, 1D. I hope all of you understood that. A person suffered a crush injury from a falling building after a bomb blast. What type of bomb blast injury is this categorized as? Now let me discuss on blast. There are 3 types of blast. Air blast means bomb is blasted in open air. Number 2, bomb blasting in the water, immersion blast. Number 3, bomb is blasted outside, but you are inside, leaning against the wall. The waves come and hit you in the wall, and you sustain injury. That is called as solid blast. Primary blast injuries are due to the shock wave or the blast wave. Shock wave or blast wave. Most commonly injured organs are air-filled organs, especially the eardrum. And number 2, lung. More the homogeneous, lesser the injuries. For example, liver is more homogeneous, so injury to the liver is less. Most common is eardrum. Second is lung. Secondary blast injury. See, once the bomb is fallen over the ground, there may be multiple debris flashing from the ground. At the same time, the bomb itself may contain maybe nails or stone or whatever, any other foreign objects. It just comes like a flying missiles and hit a person. For example, in this figure, you see a nail has entered into the cranium. So secondary blast injuries are due to flying missiles. And Secondary blast injury usually give rise to a combination of abrasion, contusion, and lacerations known as martial stride or body stripping. Combination of ACL, abrasion, contusion, laceration. Tertiary blast injuries are due to blast wind, not blast wave. Blast wind. A person may be standing, he'll be thrown out, and he may fly up and fall over the ground, or he may hit on some neighboring building, or may hit a tree and sustain injury. That is tertiary blast injury. Injuries are due to impact with another object. Number four, quaternary blast injury. The injuries which are not categorized under primary, secondary, and tertiary blast injuries. Maybe due to the fire, means flame, or maybe building may get fallen and person sustain injury, and not directly related to the initial blast wave or immediate effects. For example, if flame touches the person, or if a building collapses and if you get inside the building, or if you sustain injury, all these are quaternary blast injury. Finally, quinary blast injury. Quinary blast injury means all late effects of time. People may use the chemical bomb, biological bomb, a bomb containing coronavirus. Person may suffer from COVID. All those are quinary blast injury or nuclear bomb. Okay. And in case of immersion blast, it depends whether the head is out or inside the water. If head is out, a most common injury to the GIT. Complete immersion, again, eardrum. And in case of solid blast, both fracture of the bones, especially fracture of the bones of the legs and vertebrae. Fracture of the bones of the leg and vertebrae. Okay. The triad of abdomen and punctate lacerations are seen in bomb blast injury. See how many times they ask in INI CET. Multiple abrasions, small laceration over abdominal wall. The injuries are due to flying missiles. Martial triad is nothing but secondary blast injury due to flying missiles. Which of the following not specific of blast injury? Fractures. Okay. So person suffered a crush injury from falling building after a bomb blast. I told crush injury not due to primary, secondary, and tertiary. It falls under quaternary blast injury. Quaternary blast injury. Okay. If husband has forcible sex with wife and she wants termination of pregnancy after 20 weeks, then that's what I'm telling you. See, if the husband has forcible sex with wife and she wants termination of pregnancy, she can terminate up to 24 weeks. Up to 24 weeks. Okay. And perforation is not immediate cause of death. Immediate cause of death is septicemia. Septicemia is due to peritonitis. Peritonitis is due to perforation. So perforation of the duodenum is 1C. You understood? Abhi, Rahul, both of you understood? Okay. Now, number 40. A person was advised by his orthopedician to get regular testing of his wound done, but the patient did not give much care. During follow-up, the patient was repeatedly told to get the testing done timely, but the patient did not do, saying that he was busy. See, in this case, definitely doctor is guilty. You know why? Because once you accept a patient, it is your duty to continue to treat. At the same time, let me discuss on avoidable consequence rule and last clear chance doctrine. What is the difference? Imagine I'm an orthopedic surgeon, a patient comes with the fracture of both of the forearm. I apply POP cast at 10 a.m. today. By evening, he starts getting numbness, but he does not tell me. Next day, he sees discoloration of the fingers, but he does not inform me, does not consult me. He comes to me after 2 days where the limb has become totally gangrenous and I amputate the limb. Now he sues me in a court of law because of the doctor where he put a tight POP cast, I lost my limb. Now I can defend myself. Not 100% defense, maybe partial defense and a contributor negligence. Of course, I applied tight POP cast, but at least when he had numbness, he should have come to me. Or at least when he had discoloration, he could have come to me, I would have opened the cast, and he would have become perfectly all right. He could have avoided the complication. Patient could have avoided the complication. So, avoidable cancer rule is always for the patient. Meantime, patient comes on the same evening. Doctor, I'm getting numbness. Hey, don't worry, man. Maybe we due to edema. Go. Next day comes discoloration. Again, I say, don't worry, man. I applied more than 1,000 POP cost. No problem so far. He come only after 2 months. Third day he comes. We are entirely gangrenous. Now, absolutely, I don't have any defense. Even though I was negligent, I had a clear chance to rectify the complication, but I did not do it. I did not do it. Okay. So here, as I told you, once the doctor accepts a patient, he must continue to treat. Otherwise, it amounts to professional misconduct. Okay. So here, you were supposed to do regular dressing, but patient did not give much care. That automatic negligence. That there is negligence by the patient. The patient will after some time, at which time orthopedic again advised dressing, but did not do the dressing himself as he said he was busy. So he is guilty. So rule out. Not guilty, not guilty. So doctor is guilty under last clear chance doctrine. Okay. Now, here, of course, same question. Okay, same question. Sorry. Okay, so this question is different. The person was advised by his orthopedist to get regular dressing of his wound done, but the patient did not give much care. That means the patient was negligent. During follow-up, the patient was repeatedly told to get the dressing done timely, but the patient did not do, saying that he was busy. That means absolutely doctor is not negligent. Who is negligent? The patient himself is negligent. There is no question of contribution of negligence from the doctor. So doctor is not at all guilty. Doctor is not at all guilty. So what is the answer? The answer is doctor is not guilty under contributory negligence. Okay, what it? Now come to the question number 15. Cause of death in freshwater drought. Now we should know the mechanism. Number one, disruption of the pulmonary surfactant. Once the water enters into the alveoli, it washes out the entire pulmonary surfactant, the person may die. Now, whether it is freshwater drowning or saltwater drowning, the mechanism what takes place is osmosis. That means fluid passes from lesser concentration to higher concentration. In case of freshwater drowning, water enters into lungs. Then, because of the osmosis, from the lungs, water enters into the bloodstream, which gives rise to hemodilution. Once there is hemodilution, there will be dilutional hyponatremia. Meantime, the RBCs get swollen and gets ruptured, give rise to hemolysis. Because of the swollen RBC, it ruptures, give rise to hemolysis. RBC contain potassium, which releases potassium, which in turn give rise to hyperkalemia, which precipitate ventricular fibrillation, and it dies in about 4 to 5 minutes. Dies in about 4 to 5 minutes. Okay. Meantime, saltwater drowning opposite take place. Water from the blood enters into lung, which give rise to heme concentration. Then there will be hypernatremia, which precipitate bradycardia and cardiac arrest and dies in about 8 to 10 minutes. Okay. Now, dilation of hyponatremia, yes. Hemodilution, yes. Decrease in potassium, wrong. Disruption of pulmonary surfactant, yes. Arrhythmia, yes. 1, 2, 4, and 5 mark. Okay. Match the following snakes with their names. What are the different snakes? Now, king cobra is the longest snake in India. Grows about 4 to 5 meters. There is a hood, but no spectacle mark on the hood. No spectacle mark on the hood. King cobra, there is a hood plus spectacle or monocle mark on them. Both these are very easy. And if they give only the head, you have to see the supralabial. One, two, three. Third supralabial touches both eye and nostril. Both eye and nostril. Common trait, it is somewhat slender. There is thin stripes on the body. Thin stripes on the body. Not always. Look here. There are thin stripes on the body. In addition to that, if you see on the dorsum, there is central row of hexagonal scales. Central row of hexagonal scales on the dorsum. Fourth infralabial is largest. Banded crate. There is thick bands, maybe yellow, maybe white, maybe yellow, maybe white. Thick bands on the body. Now you see, here you can see yellow bands. Rhesus viper has got a triangular head, narrow neck. Triangular head, narrow neck. And on the body, you can see there are 3 rows of diamond-shaped marks on the body. 3 rows of diamond-shaped marks. Look here, another picture. Look, another picture. Saw-scale viper. See the junction between the body and the belly. Dorsum and the belly. It looks like edge of a saw. That's a known as saw-scaled viper. Pit viper. So far, they have not asked this in the exam. There is a pit between eye and nostril. Pit between the eye and nostril. See the another picture. A pit between the eye and nostril. Python is the biggest snake, bulkiest snake. There are marks on the body. The marks are not exactly like Rhesus viper, where you see 3 rows. Here it is haphazardly situated. Look here, haphazard marks. So match the following. Now you got the answer. The first one is common trait. Second one is common cobra. Third one is Rhesus viper. Fourth one is saw-scale viper. Fifth one is python. Bullet fingerprinting are here. Rifle firearm where the interior of the barrel is cut into spiral grooves. Cut into spiral grooves. And smoothbore, there is no spiral grooves. It is done by an instrument called lapper or rifling is done by lapper. When the lapper is passed through a solid stainless tube, it cuts spiral grooves in the interior. On cross section, you can see elevated part and depressed part. The elevated part is known as lands and the depressed part is known as grooves. Caliber or gauge means the distance between 2 opposite lands. Caliber or gauge. Distance between 2 opposite lands. Caliber of a rifle is distance between 2 opposite lands. Bullet mark. There are 2 types of bullet marking. Number 1, primary markings or primary characteristics or class characteristics. You can see what is the primary marking. When the bullet is passing through the lumen of the barrel, it comes in contact with the lance. The lance leaves impression over the bullet, that is primary characteristics. Secondary characteristics are also known as bullet fingerprinting. That is microscopic. Let me explain. Now, when the bullet is passing through, it touches the lance, which give rise to impression or marks over the surface of the bullet known as primary characteristics. Okay. See here. It is macroscopic. It is due to the impression of the lance. It is specific to the specific model because imagine tomorrow I start one gun manufacturing company. I use only one broach for rifling. If I manufacture 20 revolvers, all 20 revolvers, the lands and grooves are same. If 20 of you fire 20 bullets, in all 20 bullets, primary markings are same. So it helps to know the make of the gun or model of the gun. But what happens is, once I go for rifling, there is friction between the broach and the barrel. Striation changes. Then I go for rifling. Again, the striation will change. So, surface of the lands differ from one barrel to other barrel. At the same time, if I enlarge the primary marking under microscope, you can see the multiple striations which is microscopic in nature. Gun 1 of make A, gun 2 of make A. Both make primary characteristics are same, but secondary characteristics are different. That helps to know the individual gun. So secondary characteristics are due to irregularities on the surface of the lands, which are microscopic and specific to the specific gun or the individual gun. Now, if there are 5 people, I can very well say it belongs to human. Which human? I have to study the fingerprint. Meantime, if I receive 20 bullet, I can say which is the make of the gun, which exactly the individual gun. I have to study the secondary characteristics. That's what is known as bullet fingerprinting. So now some teachers may say that bullet fingerprints are both primary as well as secondary marking. That is wrong. It is only secondary markings. Now coming to the question number 18. Section 90 of Bharatiya Samhita deals with abortion. As per William Optetics, expulsions of the products of conception at any time before fetal viability is known as abortion. But in India, Bharatiya Nyaya Samhita section 88 to 92 deals with abortion, or they use the word miscarriage. Any time before full term, if a woman expels her products of consumption, it is known as abortion. That is an obstetrics, first trimester abortion, second trimester miscarriage, third trimester premature delivery. But as per law, expulsion of products of consumption any time before full term, it may be spontaneous due to natural causes or accidental causes, what you study under obstetrics, or maybe artificial, which may be criminal or justifiable. If the MTP is done as under the provision of MTP Act 2021, it is known as justifiable abortion. Meantime, if it does not come under any of the grounds for MTP under MTP Act, then it is criminal abortion. Here, 3 sections you have to remember. Section 88, criminal abortion with the consent of the mother. 89, criminal abortion without the consent of the mother. 90 BNS, death of the mother. Death of the mother, as I said, death of the mother means mother of the fetus, not mother of the pregnant woman. That is very important. Okay. So section 90 causing death of the mother by miscarriage. Regarding semen, I don't want to read because I already have read it. I don't want to waste time. Semen, recently they asked many questions. Confirmatory test, presumptive test. There are only 2 confirmatory tests. Number 1, presence of sperm. If you see presence of sperm under microscope, 100% you can say it is semen. Number 2, detection of sperm-specific LTH isoenzyme by electrophoresis. Detection of sperm-specific LDH isoenzyme. Presumptive signs or presumptive test or screening test. Number 1, pass ultraviolet light on suspected area. You see blue, white color. Number 2, as you know, acid phosphatase test. Most commonly done. Acid phosphatase. Number 3, Barber's test. Very, very important. When you treat semen suspected stain with the Barber's reagent, it gives rise to yellow needle-shaped crystals of spermine picrate. You can remember BSP, Barber's spermine picrate. Okay. yellow needle-shaped crystal sauce, spermine pickled. A such patient was examined and microscope pictures given below name the test, Barberio's test. Now, you see, so many times they ask, even in initiative, or NEET PG, FMG, everywhere, picric acid reagent showed yellow needle-shaped crystals, Barberio's test. Again, NEET PG, yellow needle-shaped crystals of picrate, answer, Barberio's test. Fluorescence test, dark brown rhombic crystals of choline iodide. Choline iodide. Remember, Barberio's and fluorescence, yellow needle-shaped crystals, Barberio's, dark brown rhombic crystal, fluorescence. P30. See, P30, there are two important points. Number one, it can be identified seminal stain up to 10 years, and as of today, it is most accepted method of choice. It is better than seminal serum, seminal as a perspective test. Thin layer chromatography, all these are important questions asked previously in JIPMAR. It's the only test where you can identify both choline and spermine. CPK, creatine phosphokinase, where stain can be identified even up to 6 months. P30, 10 years. CPK, 6 months. If you see Y chromosome by fish, fluorescence, in situ hybridization, definitely can say that it is male tissue. Zinc test. Prostatic secretion rich in zinc. And finally, rapid stain identification series test. Okay. So now, only test to detect both choline and spermine asked in JIPMAR, thin layer chromatography. Best test today, 8 to 10 week, best answer is CPK. CPK. Regarding semen, yellow needle-shaped crystals of spermine picrate are seen. That is seen in Barberio test, not in fluorescence test. Dark brown rhombic crystals are seen in fluorescence test, not in Barberio test. Both choline and spermine by thin layer chromatography, yes. Old 7 up to 6 months by CPK. Sponsored isoazon is a definite confirmation of seminal stain. So answer A, 3, 4, 5 are right. Coming to the last question out of 20 of RDX regarding PSV. You know, these 20 questions are open to all, so I'm going in detail. Lower dose in infant as compared to adults. Now, your idea is just to neutralize the injected venom. So whether it is a small child or 200 kg person, the dose will be same. At the same time, let me discuss another point. In India, there are 4 big bees, 2 elapids, common cobra, common crate, vipers, Russell's vipers, scale viper. Elapids are always neurotoxic, vipers are always muscular toxic, and sea snakes are myotoxic or muscular toxic. So, cause of death, a respiratory failure in elapids, circulatory failure in vipers, which give rise to severe coagulopathy, muscular toxic, which give rise to paralysis of the muscles of respiration, rise of respiratory failure. Because of the neurotoxicity of elapid, the earliest neurological sign is ptosis. Ptosis, where you get external and internal ophthalmoplegia. Once patient comes to the hospital, first you have to wait and watch for signs and symptoms. If there is symptoms and signs, you have to start with polyvalent anti-snake venom with 10 vials, which is effective against these 4 big snakes. That is common cobra, common crate, Russell's viper, and saw-scale viper. But remember one more point important for your initial examination. The ESV prepared from Hopkins biopharmaceutical inquiry neutralizes venom of the viper by paraspecific activity. So if it is prepared from Hopkins biopharmaceutical company, the neurotoxins get fixed in postsynaptic region in common cobra. That's why neostigmine has to be given in common cobra. No need of neostigmine in common crate. No need. Now, lower dose in infant as compared to adults, already I discussed, wrong. sensitivity test must be done before ASV. No need to do sensitivity test. That is mainly because it is not IG mediated, but complement mediated. If at all the sensitivity reactions are there, it is not IG mediated. So no use. Only thing, if reaction there, you counteract the reaction. Useful for venom associated coagulopathy in vipers. That is true. Cobra venom acts at pre-synaptic. That is wrong. Common crate venom causes both internal and external ophthalmoplegia. Internal and ophthalmoplegia. That is true. So now the answer is only C and E are true. That is regarding 20 questions and discussion on RDX rank dividing series. Okay. I wish you all the best. Wish you